eligibility determinations done by state workers. In her agency, if everybody who was eligible for early retirement retired, she would lose 90% of her eligibility workers. So 90% of the people who know the awful systems and understand the crazy regs would leave. That is going to become more and more of a problem. At the same time, we're trying to push people through the system. The systems are old and antiquated, and they're really hard to work with. So you're going to be pushing a whole bunch of people in and systems, and frankly, there is not a whole lot of time to upgrade those systems before you start doing upgrades to the enrollment. And then finally, I think this is going to work itself over time, but in many parts of the country, there just aren't Medicaid providers. I was listening to NPR before I came in here, and there's this sort of debate going on with some of the Republicans saying, you know, you all should sign up for Medicaid if you think it's so wonderful. That lack of provider access, which in many ways was exaggerated in Massachusetts, is really going to be compounded in states, particularly states that have a very low density sort of urban spread, and a lot of their Medicare enrollees are outside of urban centers to provide coverage. There's going to be exchanges. We call them a connector, but the more formal term is an exchange. I think you're going to see exchanges formed by states that look and feel different. I have had conversations with states where they have said, we will absolutely not implement a mandate in this state. That's going to play itself out. I think it's going to be interesting, but those states that want to get ahead of that are going to try to create their own exchanges so it's modeled after what they want to do. And then finally, there are things that have to happen in the next 60 to 90 days, so keep an eye on that. There are supposed to be high-risk pools created in 90 days. Who's laughing? Are you laughing? I actually asked somebody last night who's close to this, I said, how is that going to happen? And he completely ignored me. I've known him for years. I said, how are you going to get those set up? And it was like I had just not said anything at all. But what I'm concerned about...
Sorry to interrupt you. But can you explain what a high-risk pool is?
Sure. So a high-risk pool is something that many states have, and really what it does is the state creates a pool of coverage for people who ordinarily would not be able to get coverage through commercial. We don't have it here because everybody's covered. But in some states, so for example, if you have hemophilia, they will put you in a high-risk pool. And what you're really doing is you're taking the bad risk out of the commercial pool and you're putting it all together. They're very, very expensive to run because there's no sort of unused premiums offsetting it. They often don't cover as much. Those pools will go away once the mandate is in place and when we have universal coverage. The reason I'm concerned is that if you can't get coverage right now and you're hoping there's a high-risk pool available to you in 90 days, you're going to be watching that closely. I think in Massachusetts, it's hard for us to appreciate what it's like for folks in some other states who are just completely shut out of any sort of coverage whatsoever. So these early hits that the administration is hoping to achieve, I think folks are going to be watching very carefully. So before I wrap up, let me just share a couple of lessons learned with you. So as I said before, success in my mind is sustainable and long-term. It's things that we can look back on and say, oh, I remember when that program didn't even exist. Partnerships and collaboration are absolutely critical, and if I can say, we should challenge assumptions that we have made. Insurance companies are not universally evil. State workers are not universally incompetent. Low-income members are not incapable of understanding the systems. We really need to challenge those assumptions because, like it or not, we are all going to have to figure this out together. That's one thing that is very true about the federal piece. Everybody's going to have to sign up. The insurance companies are going to have to provide coverage, and the federal government's going to have to help support this, and the states are responsible for making sure that it doesn't fall apart. So we don't have the luxury anymore of deciding whether we do or do not want to work with a certain group. And then finally, as I said before, it's all about the member. I was out in California a couple months ago they have an annual conference on covering the uninsured. And one of the things that struck me about these folks, for 10 years they've been meeting, and every single year they felt that they were closer to universal coverage. And I was there in early February, and it was just, things seemed very dark for these folks. And they were still focused and animated and really committed to making it happen. And that's what this is going to be about as we get through the difficult times. So all of you have such an important piece of that. I encourage you, even though in Massachusetts and things are great here, keep up the energy because we still have a lot more work to do. So thank you very much.
Melissa, that was terrific. As we said earlier, implementation is the most important thing, and implementation will be done at the state level, and it will be different in every state. And if I remember my history of Medicaid, I believe the last state to actually take on the federal program of Medicaid was Arizona. For a long time, they just wouldn't even take the Medicaid dollars. So I'm not surprised that they're the first that are dramatically cutting back as well on it.